and he was
But could
tired.
you ever touch him and say, this is where he hurts?
Mm-mm.
Okay, all right.
And
Tired,
then
panting, yelping, sorry.
Sunday is when he went down on his front end. Monday I took him to
all
the
of a
vet.
sudden? Okay.
Monday I took him to the vet, and Dr. Dorset said that brain-wise, head-wise, he's not the same. He doesn't look right. Tuesday, or no, it was yesterday. Yesterday, Tuesday I took him to the vet. So then that
Was he
today.
falling a particular direction? Like, if you stood him up, which of course you did 100 times, only to see him fall down, would he tend to fall to a certain direction?
It was whatever way he was, just happened to be leaning
Did
or
he
looking.
have a head tilt? Just that you and I know what that means.
Right.
Right.
No tilt.
Okay.
He's had the unilateral,
The discharge for
crusty
2
discharge.
Crusty discharge, yeah.
Two,
It's
3 weeks.
reddish.
Yeah, red,
It
green.
looks just kind of like
It's gross.
dried,
It's dry.
Yes.
brownish stuff now. So
But it's been that way for a couple weeks.
yeah, couple weeks. Oh geez.
Yeah. The
The
vet knows
dryness of
about
the
it.
nose happens when you lose facial nerve function. The facial nerve comes from your brain stem, so you definitely had a brain stem issue for at least 2 weeks. That is a sign that very few people know until like you're like, oh, you're well studied, and you're like, oh, like that's not just mucopurulent rhinitis, because if you had a cold, it could come from both areas, right?
Right.
So when you start seeing one-sidedness, which is really interesting, because that's the side that if you touch his face and you made him blink and you do all those things, he's not reacting as well. So the brain problem, all of that's controlled by the brainstem.
Right.
Left brainstem controls left side of face, right brainstem controls right side of face. He's really interesting. His head, as he was looking at me, I thought he was being cute. He was cute, but he wasn't being cute. Two things. Head cocked,
Okay.
and then he was doing, oh gosh, this to me.
I
I'm like,
noticed
oh
that
look,
this
he's
morning.
flirting with me. And then one of my technicians walked by and says, no, he's flirting with me, he likes me. And then I looked, I said, wait a minute, he's not blinking on his left eye. So his right eye closes because it can, the left eye doesn't close because it can't.
I wiped away some of the stuff this morning. He closed it, and it was very difficult for him to open it.
Yeah, you're pointing on your right side, so do remember
side.
that the left side, yes,
Yeah.
and the left side. And there was that, you kind of noticed that there's a little bit of like gradu in the medial canthus.
Just
Yeah.
that side.
Yeah, just that side.
Yeah.
Again, that side is the side that's drier. He's not really absorbing sensory information. So, the weight loss that you see, the muscle mass atrophy over his head, over his body, all that stuff, has that just happened since the prednisone, or were you noticing that before?
Just the prednisone. We just chalked it up to prednisone because it does.
And you're probably right. So, Amy, I'm sorry, I forgot your
Megan.
name. Megan,
Yeah.
my dad, I'm so
Friend.
sorry.
Yep.
So Amy and Megan, I'm just gonna say right off the bat, so I don't know what this is, but I have some ideas. And I think that's what's gonna help you make some decisions.
Okay.
Guys, if money grew on trees,
I
you would
would
have
do
had
it.
you would have had an MRI
The first
5
day.
weeks ago
Yeah.
for crying out loud. I'm not stupid. Like, I know when people love their pets, and I get it when money doesn't grow on trees. And an MRI, I mean, it can cost $3,000, $3,500. And I do one pretty much every day, but it's not everyone that can do it. And I get it. But here's the problem, is that everybody thinks an MRI is the be-all and end-all, it gives you all the answers. Bullshit. It's just like with an x-ray, you spend money on an x-ray, you didn't get your final answer. With me, what I see with him is very telling. So I'm just gonna kind of read out the factual information that then helps you make a decision based off of what's going on. Why are we all concerned today is because no matter how much prednisone you give, he's not come back to normal, and he's actually, the entire trend is this. And it's not your fault. It's not the prednisone that's, or you not giving the right dose that's led to him being here. He was gonna be here eventually. The prednisone has slowed down that process. And all prednisone does is 1,001 things. It cures nothing but treats everything, right? That's why we like it. Same time, that's one of the reasons why I don't like it. The side effects, higher the dose, worse are the side effects. Even though blood work was never done up until this point yet, I don't think the blood work will give you the entire answer. It'll be important, but it won't give you the entire answer. What's most important is when I look at him, Monday morning quarterback walks in and says, Watson doesn't feel the left side of his face. It's not as obvious on the right, but it's there as well too. He can't move the left side of his face very well, mildly on the right side. So everything's left-sided-ish, right? That would explain dried secretions, the gradient went over here, which is ocular discharge. I touched him with a Q-tip on his eyeball and he didn't really respond. I'm like, I know corgis, you're supposed to be doing this. And then I blinked to try to scare him, and he's not blind. But he said, I don't care. His brainstem said, I don't care. Then when you test him, all 4 of his legs, he doesn't move appropriately, right? He's weak and he's uncoordinated. He's got 2 things. Incoordination and weakness is a neurologic issue, and everything's controlled by your brainstem. So voila. If there's a problem anywhere, we just found out where to look. Forget his back. That was bullshit. Whatever, you can take x-rays up the yin-yang, they won't tell you what it is because it's here.
Okay.
And that's why I said if you had one test to rule them all, it would have been an MRI of the brain. Gosh, had you done it 5 weeks ago and you got sent to the wrong place, they would have done an MRI on his lower back. They would have completely missed the boat too. Then you'd be down $3,000 and have no answer. The reality is, his brainstem disease, I would have guessed he has one of 2 things. So I'm going to be very blunt. He has a tumor in his brain, or he has meningitis. Both of them are serious, right? You guys both know that, that's why you're here. But here's the interesting part. Of the 2, they're both equally possible. What's a little bit odd is how quickly this started like that. You're like, well, how could a tumor just start up? Well, no, sometimes it happens that it was growing for a while. That's what I was asking about other symptoms. But sometimes it just reaches that breaking point and bam, all of a sudden they go downhill and you're with the parents and what happened and whatnot, and then all of a sudden. Here's the thing, the most common form of meningitis is an autoimmune reaction to the brain. An autoimmune attack to your eyes is called uveitis. Autoimmune attack to your skin is like lupus. Autoimmune attack to your kidneys and all that stuff. So you guys know immune-mediated disease. Autoimmune attack to your spinal cord is multiple sclerosis, right? So there's these diseases that are very debilitating where your immune system just goes crazy. And the poster child immune-mediated patient, young and female, there we go, both of you, right? That's like every rheumatologist is like, okay, do your knuckles hurt? Your joints hurt, and stuff like that, and so on and so forth. Meningitis in corgis, the most common flavor is immune mediated, and it just comes on like that. Any age, likes females, likes small dogs. So I have many corgis that I'm treating with chemotherapy and things and whatnot. Could this be meningitis? The answer is yes. Here's the problem with it. The number 1 drug to treat it is prednisone at high doses. Not as high as what you did, but this is why it was so relevant that you told me the dose. Because you didn't even dig around. If you went like half-mast like you were complaining about, and you're like, can we go higher? I would be like, yeah, please go higher and at least get that out of the way. Because if that doesn't work, we're in trouble. The only other thing we can do is give chemotherapy and see whether or not chemo plus prednisone can do this. So, not good if this is meningitis. And number 2, I'm not convinced it is either. Because you guys did a hell of a job with the prednisone that I would have thought there's really no immune disease that could have held up to that. But you see how it kind of starts to make sense when you're like, wait a minute, why is he even thinking that? Oh, because every time I lowered it too much, the inflammation would come back, right? So it started to make sense. But the thing that tends to be the biggest honey badger is cancer, is a tumor that's growing. And sadly enough, a dog that's coming up on 9 years of age, that is game on. That's a possibility. And I'd hate to think that, that Dr. Watson has a tumor in the brain, but if it's there, it's in the left brainstem. And that's what's causing eventually all 4 legs, because it's reached that critical size. It's like, I don't care, you can keep doing prednisone, because prednisone tries to shrink it as much as possible, but it's only going to have so much effect. My final take on this is, and I'll just be blunt with you, I know this is bad. I'm really worried about him because his brainstem's really not working well, and it's not him.
Yeah.
I'm not stupid either. When I look at him and I think, I'd say, oh, who's this cute little corgi? I expect him to dive into my arms.
Yeah.
Right? Like, you guys think about how he was 6 weeks ago, or even 5 weeks and 1 day ago. This is not him. And like, how mentally dull he seems, how his balance is off. It's also affecting his throat. Did you not hear his voice? His voice goes this. So he's having that kind of raspiness. That's throat weakness from a brainstem disease.
Okay.
So with the eye of hindsight, a lot of stuff that you kind of have been seeing or experiencing, you're like, wait a minute. You know, you can do as many.
That's one of his low forcing pictures. Yeah.
That's not him.
No, it's not.
Yeah.
This is a gorgeous picture, by the way.
Thank you.
You're like thanks.
Yeah. I know.
Oh,
Yeah.
holy nut, that's
He's
amazing.
amazing.
Yeah.
He's my pride and joy.
So if we're looking at a brainstem tumor, what are we looking at for potential treatment options and then our overall prognosis?
Brainstem. So there's 2 flavors of tumors. Flavor 1 is a brainstem tumor that just decides to grow there out on its own. Those are best treated with radiation therapy. Average survival time 3 to 6 months. Metastatic cancers, meaning the brainstem has a cancer in there from something else. The reason why that's relevant is because half of dogs that have tumors have it grow from somewhere else. My own brother and my mom died of metastatic cancer, right? They found the metastasis, and looking backwards and doing chest x-rays, CTs and stuff, found it. My brother had it from his colon. My mom had it from her pancreas and stomach. Very common for Koreans, sadly. So they both died at a very young age. And that's even more terrible, obviously, because it's a very aggressive form that's spread into his brainstem. I think that's why Sam got nervous, because I think he did like a quick ultrasound. I don't know.
Yeah,
what it was, but he found
mass on the
something
spleen.
that was on the spleen. So if that's true, because remember, sometimes you have a mass on there, like my wife has a mass on her liver, but it's a hepatoma, it's benign, who cares? Sometimes you find things in there that you know has metastasized up there. And that's not long. I mean, literally, in terms of prognosis, from the date of diagnosis onwards, you're talking about weeks, right? That's usually what happens. Why? And it's not usually, oh, it kills you. It's that it leads to such poor perceived quality of life, like my own dog Hannah had. Hannah was a Malamute that I had when I lived up in Fort Collins. And she had metastatic bone cancer, so it hurt. And I had to think about cutting her arm off, so I had to do an amputation, radiation, metastectomy of the 2 carcinomas that were in her brain. So I was going to do brain surgery from a brain surgeon, so I was going to cut them out and then do chemo. And one night, this is all amongst friends here, I'm in Fort Collins, I'm thinking I'm at the Mayo Clinic of cancer, thinking about radiation, chemo, all that stuff. And I looked at Hannah and she looked at me and she was such a bitch. She didn't like anyone, except for me.
Typical mood.
Right?
Yeah.
Typical Northern breed.
Yeah.
She loved me and she's laying on me, right? And she looks at me and she gives this big, like, whenever she does this, she goes, ah. And I looked at her and she looked up at me and she looked me in the eyes and I was like, whoa. And I didn't expect her to kind of communicate with me to that level because she was gorked out from medications to stop her pain. She was on prednisone as well too. But she looked at me and she kind of, it's almost as she said, are you really planning on bringing me in tomorrow to do this? And if she had a middle finger that she could raise, she would have done it. But she looked at me and she kind of said, please don't.
Yeah.
And that's very hard for me. Asian boy who's been like top of his class his entire life, type A personality, love my dog. Don't tell me what to do. I love my dog, I'll do everything. And listen, I didn't have tons of money, but I could have made it happen. In the end, you could sell your left kidney and make it happen. I get, like, we can make things happen, but did it make sense? The answer was no. So, what did I do? I did something that I didn't think I was capable of doing. I said, no way, I'm not gonna take her into the hospital and have her euthanized there. Right? I had all my friends and all that. I called my friend over, and which is akin to you saying, I want a veterinarian that's a mobile veterinarian to come to my house, place an IV catheter, I'm gonna spoil the shit out of her, which I gave her steak, which she loved, and I gave her that one thing that she could never have, chocolate.
Yep.
And she ate it, and guess what she did? She spit it out, looked at me, and she would have given me the finger. I laughed my ass off. She was like, it's almost like I waited my entire life for this. She hated it.
Oh, that's great.
But the steak wasn't me, and most important, it was the right decision. I did it in my house.
Yeah.
Not in the sterile walls that smell like 1,000 other dogs. How many hospitals have you seen? How many visits have you done in the last month? Like, I'm not done. By the time people get to me, they've been through the ringer. And I know that. So for me, it's all about, in the end, what is the quality of his life right now? And his quality, it's pretty bad.
Yeah. Yeah.
You know? And he doesn't seem like he's in pain. It's more like he's just not him. He doesn't get it. He's dull. Mentally, he's dull. He's like, what's going on? Doesn't feel his face very well, doesn't swallow well, can't walk. He tries to walk, falls down.